shy, but we still have a group of nice people and some nice things to share with you. So we hope you enjoy it all the same. And I'm going to start sharing a bit. Can everyone see my screen? Are you able to see my screen?
Yes.
Yeah? Okay,
Yes.
great. So let's start from the beginning. So what is Huntington Academy? Huntington Academy is a project created by the European Huntington Association together with 3 of its members to try to help fill the gaps in the care and support for families living with Huntington's disease. So the ultimate goal of Huntington Academy is really to give people the knowledge and the tools to feel less alone and to feel more empowered in their care tasks. So during this webinar, we will do a short presentation about the background and goals of this project, and then we will do a guided tour of the Huntington Academy platform. We'll also hear a bit about some of the team members and also the main contributors, and we will also have time to address any questions, comments you might have. Since we have quite a number of attendees, what I think it will be more efficient is for you to share your questions and comments in the chat box, and then Yarelis will help us collect them from there and ensure that they are addressed, okay? So starting with a bit of the background of the Huntington Academy. So this has been a dream for the European Huntington Association for many years. Astrid recalls that this started as an idea among the members of the Quality of Life Working Group from EHDN. This is a group that is not active anymore. I think it's been replaced in a way by the Multidisciplinary Care Working Group now. But of course, this was also a dream for a lot of HD associations around the world, namely the Swedish Huntington Association, who has created a very successful online training about the basics of HD some years ago. Also, as a kind of a background for this project, back in 2022, so some years ago, the EHA has run a big survey to understand how HD families across Europe have access to care and support. And the results of this survey were really eye-opening to us. So we found that there are huge differences in the care provided between countries according to the region where families live. We also found that families everywhere usually want the same basic things, like psychological support, for instance. And we saw that key services like nutritional advice or physiotherapy are still limited and hard to access in most of the countries, either because they're not available at all, or they are too expensive. And of course, lastly, as the background of our projects, it has to do with all the reports we hear from people in the HD community talking about the many challenges they have to face and the many hats they have to wear when they provide care to their loved one or to people impacted by HD. And these challenges of providing care to people with HD have been reported not only by family members who provide care at home, and we will call them informal caregivers, but also by many healthcare professionals from working with HD families in different fields, and we will call them formal caregivers. So having all these challenges and gaps in mind, the European Huntington Association got together with the Belgium, the Bulgarian, and the Spanish Association to create a proposal for an Erasmus Plus call in the field of adult education. And our big goal back then was really to create an e-learning platform that could provide support, education, and training to both formal and informal caregivers of people living with HD. And we called it Huntington Academy. So we wanted this platform to be free and open to everyone, so to help make care more equitable and accessible, no matter where people live. That's why we also wanted to offer this platform in several languages, because we realized that language is very often a big barrier in the access to good care. And we also wanted to make sure that this platform reflected different HD realities. So we made sure to bring different voices from family members and healthcare professionals from different parts of Europe. Another key goal of this platform was to promote the co-creation process or the co-creation of knowledge. So we try to use the real-life experiences of both family members and also from healthcare professionals to make this training practical but also meaningful. We also wanted to focus in having an holistic and multidisciplinary approach to care, showing that how giving often means having to wear different hats at the same time, just like the photo I show you. We also wanted this platform to be hands-on and useful for everyday care. And we wanted also this platform to be flexible and adaptable so it can grow and have new contents over time. So this was an ambitious plan, but we got a green light from the Erasmus Plus in early 2024. And since then, we have been working a lot to bring all these goals and features, all this to life. So this is the NICE team who has been super committed to make this platform a reality. The photo on the left side was taken at our kickoff meeting in Brussels 1 year ago, and the photo on the right side was taken more recently at the HDYO conference in Prague some months ago. And these are some of our experts contributors. So we have established 3 national advisory groups, 1 per each of the partner countries. And these groups were composed by both knowledgeable family members and healthcare professionals with different backgrounds. And they shared with us all their real-life experiences of providing care to people with HD. So all their contributions were used to create the contents of this e-learning platform. And we were able to enroll 32 contributors from all the different countries. And we had a balanced number of family members and professionals. So for the content creation, we started by creating 2 interview scripts, one for family caregivers and other for professionals. And then we did 32 individual interviews with all the members of the 3 national advisory groups. And these interviews were done either online or face-to-face. So each interview was recorded, transcribed, checked, and then summarized by the association representative who did the interview. And after that, the summary was sent back to the contributors so that they could validate it. And once the contributor or the person approved the interview, we then translated it into English and merged this interview with the other contents so that then we could build the course contents. So just to give you an idea, this on the left side, you can see the interview script. So we started with this interview, and after the interview was summarized, validated, translated into English, we started to use a color code to help organize the contents of each interview. For example, we use green to highlight the topics that could be used in the course related to neurology. We used blue for topics related to communication skills, yellow for topics related with HD basics, and so on. And then we grouped all these contributions according to colors, by course and by lesson. So finally, everything was summarized, checked, translated, and added to the platform, where it will be available in 4 languages: English, Spanish, French, and Bulgarian. So each course is really made of several lessons, and each lesson has a few main sections. So first here we have the section with the main content, which was created from the interviews we did with all the HD family members and professionals. Then we have a section with where people can find further links to other readings and resources in case people want to read more about that topic or dive into that specific subject. Next, we also did have a short quiz to help people check what they have learned and make sure that the key points are clear. And finally, and this is a very important thing, we included also quotes from the people we interviewed. So real words from real people, both family members and healthcare professionals. And we did this because we felt it was really important to keep their voices in the platform. So this methodology allowed us to create 9 courses. We have 2 main core courses and 7 more specific courses. So these are the 2 mandatory or more general core courses that are related to the basics of HD and also to communication skills. And we selected these 2 courses as the core ones because we saw this as really key starting points to help ensure that people are receiving the best possible care. So by giving users a solid understanding of the disease, but also helping them to communicate better with families with Huntington's disease. These courses were also thought to be crucial in establishing a common knowledge base for all the users of the platform, independently of their level of expertise in HD. And then, of course, as I've mentioned, we had 7 more specific courses which we thought would cover some of the main areas related to HD care. So neurology, psychology, physiotherapy, speech therapy, occupational therapy, oral care, and nutrition. So the total 9 courses. And now I would like to say just a few words about the Huntington Academy webpage, which you can find clicking on this link or following this link. So this is where you will find everything in one place. Information about the team, information about the contributors, about the values behind the project, the goals, and obviously also about the courses we have created. So this works as a main entrance door to the Huntington Academy courses. And in just a moment, Beatriz will walk you through it and show you how everything works. But I would like to share with you a couple of quick notes before we move on. So the first thing I would like to say is that right after this webinar, hopefully you will be able to start trying out 2 core courses of this platform in English. So HD Basics and Communication Skills. The translations of these core courses will be added as soon as possible over the next few days. And the goal is really to have all the courses available in the 4 languages by the end of September. So please stay tuned, and because we will regularly upload new courses in the platform over the next weeks. Another thing is that we are planning to host 3 country-specific sessions. So 1 session in each country in the local languages. So if you're interested to learn more about it, please get in touch with the partners to get more details about that. And also to say that later in September at the EHA conference in Bucharest, we will also have some sessions dedicated to the Huntington Academy, and some of the contributors will also were invited to speak at the conference session. So you can also learn more about the Huntington Academy there. So this was what I would like to share with you, and now I will hand it over to Beatriz, who will give you a tour of the platform and show you some of the key features of the Huntington Academy. So Beatriz, the floor is yours.
Can you see my screen?
Yes, we
Can you
see
hear
it.
me?
And we can hear you. We can see you and we can hear you. So all good.
Okay, I'll just go back to share with sound because we left the video. Okay, sorry. So for the ones that don't know me, I'm Beatriz, and I'm the communication manager at the EHA. And I'll just give you very quick run through the website, and then we go into the courses and the actual content. So here on the home page, we have some quotes from the team members, and we have here the methodology as Philippa mentioned, and also the course list below. And on the end, we have the partners of the project. In the About Us section, we have an explanation of how the project started, our values, the team members here below, and some of the contributors also below. So you can then take a further look into their bios and information. So the courses content, the courses tab is pretty similar to the one we can find on the home page. And the contacts tab, here we have the contacts from the partner associations. You can subscribe to our mailing list, and you also have my email here below. If you have any issues, questions, or feedback, you can reach us directly. So finally, we have the accounts tab. So here in the My Account is where you'll find, sorry, my internet may be a bit slow. Okay, but I will explain it. So in the My Account section, you will find, after you register, you can find there the information of your profile and also the courses that you are enrolled in. So all the progress will be saved here, and you can learn at your own pace. And every time you leave the platform, you can come back, enter your account, and you'll see the courses there where you left them. So I will just quickly go through the registration form just to show you. So it's a regular form, and all the data will just be used for statistic purposes for the EHA. And now I'll just quickly log in to show you the courses. Okay, so after logging in, this is what it looks like. And I have here the two main courses that I will be talking about. So I will enter now the HD Basics. So we have this first introduction page with a video from Astri explaining a bit the purposes and why this first course is so important. So I will play it.
Welcome to this course HD Basics. This is really the place to start, because here you will get a nice overview of the disease causes, the symptoms throughout the different stages, and also the potential therapies or approaches that you can make use of. In this course, we emphasize in particular the importance of early diagnosis, specialized care, and also genetic counseling. And throughout the course, this course and all the others also, we emphasize the importance of the holistic care and approach, so that you don't get lost in details but see the broader picture and also the complexity of the disease and what it implies for the person with it, but also what you can pick on and different elements to support.
Okay, so after looking at the video, we continue here to the course. And we have the main page of the course. Here we can see the course description, the objectives down here, and the content here below. So before you start actually learning and taking the lessons, you can see all of the content that will be inside the course. So for example, juvenile HD, what you need to know, diagnosis, symptoms, so all of these topics here. So I'll go back and start with the first lesson as an example to show you. So this is the actual content of the lesson. We try to complement the information with some illustrations and some quotes, as Filipa also mentioned, from the contributors, both healthcare professionals and family members. So this is the first one on the HD basics. And here below, it's very important that you mark complete whenever you finish a lesson, because this will save your progress and will update the progress bar on top. So I will do that to show you. So the lesson here is progressing, and now I'll go to the next topic. So every lesson includes a further reading and resources that all these links will open in a different tab, so you don't lose track of where you're at in the course. But in case that you want to learn more or need to have some other resources, you have here other links related to the content. So moving on, we have a quiz per lesson. So every lesson has one quiz, and after each answer, it will give us the correct answer if we get the wrong answer and the explanation. So the feedback is automatic in any case. I will just go through the quiz to show you. And in the end, it will give us the number of questions answered correctly. We can view the questions and the explanation in the end, so we can go back to review it, and we can retake the quiz as many times as we want. So this is kind of the structure of the course. So one main topic, one further reading and resources, and one quiz. I can show another example. So this is juvenile Huntington's disease, again with some illustrations to help with the text and everything, and the quotes. So moving back to the course, every course at the end has a conclusion and final assessment lesson where you can find a recap of the key concepts, so a recap of the whole course, and one quiz that will be a bit longer than the others because it will be a final quiz. So after all of this is done and is marked complete, as you can see, every time we mark something complete, so there's a green line, and in the end will be a green arrow. So after everything is done, there will be a certificate automatically appearing up here. So I will now show the communication skills course. Also a video from Astrid that I will quickly show.
Welcome to this training on communication skills. Communication is a crucial element in all human beings' interaction with each other, and in Huntington's disease it's really affected. And that's why you in this course will learn more about how this disease affects the person's ability to understand you and communicate with you, but not the least how you, being a carer, can adapt and communicate most efficiently. The aim is that you, through doing this course and training yourself in daily activities, actually improve communication, improve interaction, and thus improve quality of life for all of you.
So I'll move on now. Again, it's the same. So course description here, course objectives. And in the communication skills course, we also have a questionnaire link here that you will answer before starting the lesson, so we can kind of assess the communication skills before the course. So again, we have all the contents here. I will enroll to begin. And in this course, the structure is the same. The difference is we included some videos from family members and healthcare professionals recorded some time ago on a 3-day online course by the EHA on communication skills. So the information is still very up to date. I can show you here an example from Saya. So this is a bit from the interview she did in that course. And also we have down here from Jimmy Pollard, also the nonverbal clues that reveal cognitive challenges. So this is kind of to complement this communication course. And I think that's it. Not sure if you want me to go into any topic specifics. In the end, again, we have some general additional resources that can be helpful after finishing the course.
Thank you very much, Beatriz. I think it was very clear and nice, this overview. And again, as I said before, it's good that people will have the opportunity to try this at home afterwards. So these two courses are already available in English. So after this webinar, you can start trying them. But now I would like to speak a bit with the people in the background, so the people who made all this possible. And I would like to start with the contributors. We have here with us Rudy and Regina and Albert, representing the 3 partners. But of course, each country had more contributors. So I would like to start to ask you to please introduce yourselves, maybe starting with Albert, so that people know a bit more about you. Albert?
I'm a member of the Belgian League, Huntington League, since about 20 years, when my son was diagnosed for Huntington. And since then, I have been working in the league, and now I'm the oldest member of the board of the league. So I'm the chairman of the acting chairman, just because I'm the oldest. I would prefer not being the chairman and another one, but that's fine. Okay.
Okay. Many thanks. Rudy.
Hi, everybody. I am just a physical education teacher, and I was a carer of my wife from 2000 probably up to 2024. Mainly, I got a lot of skills because of her, and I learned many things, sadly, by myself, because I didn't have enough information at that time. And I wanted to contribute in some way that the new ones, the new carers, cannot have the same problems like me. So that's the idea. I'm here in Spain. I live close to Barcelona, and this is it.
And you are one of the most well-known faces in the HD community as well, as Albert is. Regina, would you like to briefly introduce yourself also?
Sure. Hello, everyone. My name is Regina. I'm from the Bulgarian Huntington Association. I've been working here as a psychologist, psychotherapist for about 10 years now. And in this project, I helped a bit with the drafting of the interviews, and then I was interviewed as a contributor from the point of view of a psychologist. So I hope that it was a valuable contribution. I'll share a bit more later.
Yeah, and I would like exactly to start by that point. So what are your thoughts, your feelings about this experience, about being able to contribute to this e-learning platform. Albert, let's.
I would first start with expressing my deepest gratitude to all the team has been working on this project, because we were waiting for that sort of project since the 25 year I've been involved in the functioning of the LEAR. Having all useful information available with one click on one side in plain language, and is as many languages as possible. That's the dream we had, and it's now almost achieved, not fully yet. So that's great job that has been done. But it was a tremendous job, because we had no experience in developing such a project. We had luckily we had Olivier, who has been working on such project before, but not as complicated as so. And I have to express my gratitude to all the team. The team means the family, the scientists, the caregivers, official and just informal. All people has been making that tool possible and available. That's great achievement. So that's my feeling after having, for the first time, seen the whole presentation.
And you haven't seen it in French yet, so I hope that you will be even more happy after that.
We will see. We will see the quality of the translation. But okay, we can ask Gigi Gaté will help us, of course. Yeah.
So Rudy, Regina, what I would like to hear you also about, how was it for you to be able to participate in this project, in this platform?
For me, it was really a privilege, and also amazing, because I was talking before in 1998, when I started to find out the internet, in the beginnings of internet and the electronic emails. I only could find one person in Vancouver, Robert Laycock, that helped me a lot. He sent me an email talking about Huntington, about everything that was about to happen to me. And that happened exactly. And that guy helped me a lot to planify my life. So I need to thank you very much to that guy. So if I can do the same here, help many people to take care of their beloved ones, for me is really amazing. And one of the ways was that I tried to get documented and know more about this infirmity was coming to the congresses from 2004 in Guadarrama in Madrid, the first of the European Huntington Association in Europe. No? And from that time on, I belonged to that organization and others, and I tried to improve my skills and well, becoming a kind of expert. I'm not having a PhD, but well,
you have the real experience. You have the lived experience, which is unique.
Yeah. That was for that reason I say thank you very much, like Albert, to give me that opportunity to be generous with my experience.
Many thanks. We thank you. Regina, how was it for you?
Well, Rodolfo's sharing got me thinking that by the time I got acquainted with Huntington's disease, there was plenty of information online, at least in English, though. And I have no idea what it is to be in such a context where you're trying to find the scarce information all over the world. But I still found it very difficult to answer the questions, even though I had participated in drafting them. The side of answering was actually much more difficult because I could see how many more questions they opened. So for good or for bad reason, I think that the content we all shared opens up a lot more questions that could maybe be discussed in some live events, groups, gatherings. I think that is good because this could provide more detail for the people who go through the HD Academy, and then they can ask some more precise questions. But as a psychologist, I found many difficulties being interviewed. How not to generalize, but to give answers to the specific topics, because I haven't seen two cases that are too similar. I had difficulties reflecting the variety of needs because the positions of each patient and caregiver are very different, not just not just in line with the stage that they are in, but with the family, with the family context they are in, with their own view of life, the different symptoms of the disease. So yeah, there were many difficulties trying to gather up all the information in just one interview. I think perhaps the HD Academy could open a
But
way for more resources.
But that's really interesting what you're saying in the sense that Huntington Academy can help generate new questions. So I also would like to understand what's your views about, besides raising or helping to raise new questions, what do you think are the benefits or the impact of this kind of new tool, not only at the national level, but also in terms of the more global level of the HD community?
Yeah, in national level, I will straight say that not so many families are engaged with nutrition, speech therapy, sometimes even physical therapy is not so well informed, especially in cities away from the capital. So having detailed information in these areas is definitely a huge contribution to at a national level, but at a multinational. I think the most valuable contributions, firstly, as Astrid said in the introduction videos as well, it's the giving of a perspective, a holistic care, the different resources and approaches that could be taken to taking care of an HD patient, and I think that the authenticity of everything that's shared from non-formal caregivers is something that's completely new to the field. So it's primary.
Albert.
I mean that we have the know-how, but we need now to make people know that we have the know-how and the know-how is available. The key point starts now with the dissemination, with communication. We need to make sure that any family in each country will be aware that that tool exists. And also all the caregivers, and there are quite a lot, that happen to come in contact with a patient of a family in Huntington would have the opportunity to at least one time go into the tool, into the course, to see what are the contents and how the tool can help them to better take care and understand the disease and better take care of the patient and helping the families. So we have quite a difficult game to play now, because it's not a point to have the tool.
It's
The tool is
spreading the word about it.
Okay, the tool is desk work, and that's fine, great desk work. Now the challenge starts.
Yeah.
Making people know and use the
Aware.
tool, of course, and that's extremely important. We could put a challenge and count how many contact we can make in 1 year with the community as a whole. Would be interesting.
That's why we also have the statistics of the users. I think it will help us also to try to understand, or to have numbers about the impact. Rudy, what are your thoughts about the impact of this tool?
I think it's going to be great because you have done an amazing work after our interviews, because we gave you a big salad mix of many vegetables, and you separated the lettuce here, tomato here, carrots here, and then put in order, and then you put your professionalism on that support that we gave you. So now it sounds professional, because what we can do is giving you simple things of life, and you got those simple things of life and make it professionals. So this is an amazing work, and I think it's going to be a great thing for the ones that are starting, because once you are starting with Huntington, you are kind of lost. A cloud is over you. The last thing that you have is time. So you are saving a lot of time for that poor people that wants to be cared, and you are, making their life easy. So that is a great thing for the care.
If I may add something to what Rudy said, we have the Facebook site, and we have all the social communication, and every day I'm frightened and shocked to see how people know less about Huntington. There are families concerned with Huntington, having in fighting against the Huntington and the disease and the consequences, and not knowing what is that disease, and not knowing where to go to get simple and clear information. So we have a challenge to help them to know that the information is now available.
Mhm. Mhm. So many thanks, and thank you for your kindness and for your generosity in sharing your lives with us, and making this possible. Thank you. And bye, Albert. I know you have to leave now.
Okay, thank you.
Thank you.
Thank you.
So I would now like to hear a bit about the wonder team behind this project. So Ruth Yarelis from Spain, Olivier from Belgium, and Regina. She's in a double role here from Bulgaria. So I would like to ask you to start also by introducing yourselves briefly. Can we start with you, Ruth?
Hi, I'm Ruth from Spain. I'm a family member. My father passed away from Huntington disease 12 years ago. And in this moment, I started to have many free time. And I decided to involve with the Spanish Association. And now I'm the chair of the Spanish Association and also of the Spanish Federation of Huntington disease.
Olivier.
Hello. Hello, I'm Olivier. I'm a wonder boy. I didn't know. Thank you, Philippa. I'm working for the Belgian Association now for 7 years, the French-speaking Association of Belgium. And I'm a communication officer, and now I'm also working on projects.
Thanks. Yarelis.
So I work with Ruth at the Spanish Association as assistant project manager and patient advocate. So yeah, double hat there.
Okay, many thanks. And Virginia, you already.
Well, I'm speaking for Natalia, who is our chairperson. She created the Bulgarian Huntington Association 11 years, and if we have to be precise, 4 months ago. And none of us are family members actually, but she encountered several families in Bulgaria that needed information. They needed someone to mediate communication with hospitals, professional caregivers, medical professionals. So little by little, the association started working with these families, connecting them, and meeting quite many of them from Bulgaria up until now.
Okay. And I think you are representing 3 countries, as we already mentioned, and this is really one of the strengths of this project, is to represent such different realities, South, Central, Eastern European countries. So one of the things I would like to ask you is, how do you think this partnership, this relation with other countries, has influenced and added value to your work? How did this partnership work for you? Ruth
Nice.
or Olivier?
Yeah, okay. I'll start. Yeah, for me it was really valuable because we had contributors from several countries, and maybe so their input was different because what they will country was maybe as a professional or informal caregiver. So I think that was really one of the main points that was really interesting there.
Well, I think was a challenge work with many people because we have different timings and we have different language. So it was a real challenge because for us was the first time that we are working in a project of this level. But was a very positive experience because you can out of the box because in Spain we are in touch with many of the local associations, but now the reality of the approach and the care of the Huntington disease in other countries was very interesting, and I think it's
Group 3, is it?
No,
only
group 1 and 2.
Oh, sorry.
and I think, hi Astrid, and I think that is very important to validate this knowledge because we are building this platform together. So this information can be useful for many different families across the world because when you have the content in different language, I think we can have a powerful impact in the community, in the HD community.
Definitely. Yeah.
I totally agree with Ruth, and I think that it was an enriching experience having different perspectives, but at the same time, seeing how challenges are like a stable line and now families in each country, they experience similar challenges that can be attacked or solved in a way with different perspectives. And I think that's, if we use the example Rudy was saying about the salad, it brings more toppings to the salad and kind of makes it more colorful and rich.
Yeah. Regina, any thoughts about this?
Yeah, well, as I discussed with Natalia, we were talking that the project and its multinationalness definitely helped us see where we are on the map because there's quite a difference in care and in what needs families emphasize on depending on the country they live in because the very background of the country, of the state agencies, they provide different tools to help patients and families, and the situations are quite different. But in any case, talking to each other, I think we managed to see how we can complement our knowledge, and especially how we can direct professionals into the topics they need to speak about and think about because a profession, let's say I would focus on some of the challenges here in Bulgaria, talking about specific topics with patients, with their families. In another country, the focus would be elsewhere, something that I would never have thought about. So yeah, it's kind of a complement.
And how do you see this project or the benefit of this project in the long term in your country?
In the long term, I think that now that we meet new patients, it would be a lot easier to direct them to the core materials, give them specific information that they need when they start their journey. Having that much focus, a place where they could go and see the essentials, it could save them a lot of time, a lot of emotional burden, a lot of worries, because even if something is difficult, it's a bit less of a burden if it's clearer. So I think that they could, patients from now on and their families, they could use a lot of their resources in something to better help them instead of orienting themselves what awaits.
Yeah.
Thank you.
Olivia.
Oh, just to make somebody's speaking. Okay, to make it simple, I'd say that for us, it's to direct people one source of information that's validated, and that comes also from real experiences. To give several brochures or different source of information where everything is gathered in one place.
The bit the message that Albert is always reinforcing, right, and highlighting. Ruth.
Yeah, indeed.
Well, personally, I think that spent time, long conversation, 2 hours with the contributors, with each contributor was a gift because they are very generous and share all their knowledge, all their experience, and also the family members share the small things that they really learn to improve the how they face the challenge of the disease. And these small tips, the real tips about the challenge of the disease is like a treasure because they need cope this difficult situation to learn this, and if you can know this before, you can prevent many difficult situations, many problems, so I think we have the privilege to have this knowledge and share these practical tips and this advertisement with many families, because we are in touch with hundreds of families in Spain through the association, through the federation, and have this knowledge in the first hand. It's a gift. This is my opinion.
There was a nice illustration of a lighthouse. We included it somewhere, and it's a kind of the idea, right? Now we have this kind of lighthouse that can help guide people in their care tasks and challenges. Rudy, yeah.
I wanted to add that I remember in one opportunity I visited the Huntington Center in Overdoing in Holland, and I have seen that the sick people used to have access to some screens, and they touch the screen and they get in touch immediately with a professional, with a physiotherapist, with a neurologist. And why don't we have this for a carer when we are desperate looking for something? And we have this. This website is like this.
Yarelis, I don't know whether you want to add anything, or should we start diving into the Astri? Are you there? She is, but she's not. Yarelis, I don't know if you want to add anything, or should we dive into the questions, into the chat box? I don't know.
I think in the long term, the geographical barriers that are experienced now by the Huntington's families are kind of hopefully be dissolved, and more professionals across the different countries can be prepared and have access to this knowledge. So yeah, I think that's going to be a good thing in the long term. In the chat, we've had some questions about this resource being available in other languages. So I'll let that answer to you.
So this was done as an Erasmus Plus project, so with kind of strict rules. But of course, the idea is to expand after the end of the project, which will happen later this summer. So our goal is really to have this webpage, this platform available in as many languages as possible. So definitely this will be something that we want to do. Yeah. I think we are already a small number. So if people want to ask something, or I don't know whether there are other questions in the chat box. Yarelis?
That was the main question. And is there a feedback questionnaire at the end of each course?
So right now we just have a quiz about the contents, but I think that's a very good idea, and we still have time to, again, this is a flexible and adaptable platform, so there is always room and space to add or take things and features, and that would be a good idea, I think. Yeah.
There's another question from Christian. Any idea in the pipe of sharing best practices from families?
I think actually the main goal of this platform is for many family members to share what they consider to be best practices. So I think we are doing that already in some sense. So as we explained, we have created 3 national advisory groups. It's a very I would say, I don't know, pomposo, we say in Portuguese name, but mainly it's about bringing together knowledgeable family members and professionals. And what we asked from them was to really to share with us what were their best tips, best practices, what were the things that worked in their daily lives when taking care of their loved ones. So I think we kind of already have that and are providing that, I hope.
Thank you, Filipa. Someone also, it's not a question, but I hope I could contribute to this initiative. So the question would be, how could people that would like to contribute could be a part of the project?
I think you just need to send us an email. And again, I think this is a very flexible and adaptable platform. And we really want to add contents and add languages and make it as best as possible. So please reach out to us and we can speak about it and discuss how can this happen. Yeah.
Another person says, I hope I wasn't the only French person who attended this webinar. Will you send a feedback of it?
A feedback of the webinar, or
I guess that's what I understand.
we are recording the webinar, so we will make it available in our communication channels. So this will be available, and as I said before, we will do also some sessions in French, in Spanish, and in Bulgarian. So please reach out to the local coordinator or partner to know the exact dates. Again, I think language can be a barrier, so I think these sessions will also be very valuable.
Thank you, Filipa. Those are the questions for now.
Okay, are there any more thoughts? Any last words that you want to say? Rudy, Olivier, Ruth, anybody, anyone?
Thank you.
Thank you. I'm happy to have worked with you on this project.
And actually, it all started with you, Olivier. Olivier just
finally some flowers.
Olivier just reached out to us and said, "Do you know there is an Erasmus Plus call? So maybe we could do something together." So yeah, this is your fault.
No, my mistake.
I want to say also thanks to the European Huntington Association to give me the opportunity to the Spanish Association to be part of in this project that I personally, I think I learned a lot during this hundreds of hours of work. I think was a fantastic privilege to be part of this. I hope that all of the attendees of this webinar can help us to spread the word of this platform, because I really think that in this platform we can find encapsulate decades of experience from dozens of experts. So I think we must spread the word of this platform as possible. All as you can do it. So.
Yep.
Yeah, thank you for making us part of the project as well. It's really useful for Bulgaria to have this resource in our mother tongue so early on, because I hope that it will be also translated for other countries. But I wanted to add that I think it was very valuable to the Bulgarian informal caregivers, because inviting them for interviews and interviewing them, we got to the realizations that they're not used to being viewed as contributors. Here in Bulgaria, they usually speak to some healthcare professional and only absorb information, usually feel a bit disoriented, not knowing what they're doing. And I see it was very valuable for them to be in the position of a contributor. So thank you.
Okay, so I hope you are as excited about this as we are, and I hope you make good use of this. And please send us emails, send us your feedback, send us comments that we will try to incorporate as best as we can. This is a work in progress, so we are trying our best, but of course there are always things that we can improve. And hopefully, again, we will have this available in much more languages. So, yeah. Thank you for bearing with us this hour, and I hope to see you soon.
In Bucharest, in the EHA conference in September.
In September.
All of us, we are in the conference talking more about this project and learning a lot about the Huntington updates, and the most important, sharing experience, life experience, family experience, networking experience. So please join us.
Yeah, join us there. Yeah. Okay, bye-bye. Have a nice evening and see you soon.
Thank you.
Bye.
Bye-bye.